Hello, I'll be talking about the acute effects of total body irradiation or total body exposure to radiation. So, if this is a scale where the dose is represented in gray, and the symptoms and the management, how will you do that is basically what I'm explaining right now. From the exposure of 2 to 5 gray, what you see is hematopoietic syndrome. Hematopoietic syndrome is basically due to the cytopenias. Here you will see prodromal syndromes. I'll be telling that. What is lethal dose? 50 is lethal. 50% of the patient exposed will die. So 3.25 to 4 gray of exposure without any treatment, the patients die. Up to 7 gray, even with antibiotics and supportive care, they can die, and up to 10 gray, even with BMT, they will die. So what are the prodromal syndromes? Is within 50% of the lethal dose, you will see easy fatigability, anorexia, and vomiting. Supralethal dose, you will see fever, hypertension, and immediate diarrhea. So I was talking about hematopoietic syndrome. So hematopoietic syndrome, I just said that there will also be latent period of 3 weeks, where there will be chills, fatigue, petechial hemorrhages, loss of air, and infections, and and the death is usually seen within weeks. So within 4 to 8 weeks, the time of death is within 4 to 8 weeks. Now, what is GI syndrome? GI syndrome is seen from 5 to 12 or up to 20 gray. Here it is due to the loss of the intestinal lining. So their symptoms will be again prodromal syndrome and prolonged diarrhea. Prolonged diarrhea is important, which indicates that the exposure is around 10 gray. Now, the time of death is usually within days here, 9 to 10 days, within 9 to 10 days. Now, what is cerebrovascular syndrome? Cerebrovascular system is syndrome when the exposure is from 50 to 100 gray. So here it is always always all fatal. So death occurs here within hours. This can be due to capillary leakage in the brain, or the symptoms will obviously be nausea, vomiting within minutes, disorientation, loss of coordination, uh, respiratory distress, diarrhea, convulsions, and coma as well. So how will you triage the patient? You will triage the patient based on the onset of vomiting. If the onset of vomiting is more than 4 hours, then you can think that the median dose of exposure is around 0.25 to 2, the median being 0.9 gray. But if the exposure with the vomiting is within 4 hours, the onset of vomiting is within 4 hours, then it is a sign that more than 2 gray exposure has been there. So median exposure is 3.6 gray, median dose for this. So you need to hospitalize these patients. So what is expected management? 0.25 to like up to 2 gray, there is no management, so you'll just observe the patient. And from 2 to 5 and 5 to 7, here your expected manage, and here prophylactic management. So because hematopoietic syndrome, so you'll see cytopenias there, and here hypotension you'll be seeing. So because of that, there will be risk of infection, so you'll give antibiotics. Since cytopenias are there, you'll give transfusions because hypertension is also there. And beyond 2 gray, you will also start with colony stimulating factors. With this has to be started within 24 to 72 hours of exposure. Now 8 to 10 gray, BMT bone marrow transplant is what is done. 10 beyond 10 gray, just supportive care, because more than 10 gray, there have been no survivors, so you have to just give supportive care.